Patients frequently present to the office with a complaint of snoring. Although they may have tried many different forms of therapy to improve it unsuccessfully, they really don't know what's causing the snoring in them or what kind of causes it in general. There's actually 5 common causes of snoring. Anatomical blockage of the nasal airway is the primary driver of snoring for most patients. The second most common cause is enlargement of the tongue. Actually, the tongue will enlarge as a response to the nasal blockage because as we mouth breathe, the tongue will respond by progressively and irreversibly expanding. If the patient has disrupted sleep quality because of a blocked nose and enlargement of the tongue, it does produce less quality deep sleep, which alters their metabolic hormones, cortisol, growth hormone, insulin, and testosterone, which creates centripetal weight gain in the face, neck, and belly, and that will further accentuate their snoring. In some individuals, the soft palate and uvula will actually get stretched longer, and the long uvula is also producing a significant amount of snoring. Those patients will report a swollen uvula when they wake up in the morning. And rarely in adults, the tonsils themselves can be large. That's more of a problem in the pediatric population. In an ideal situation, a person has a wide open nasal airway, and the airflow will tend to be very soft and non-turbulent. If there is restriction of the airway, anytime you force flow through a narrow opening, it makes the flow faster and more turbulent, like putting your thumb over a garden hose makes the water come out faster. Rapid and turbulent flow will reach the back of the throat and produce vibration of the soft palate and uvula and snoring. It also produces a negative pressure to pull the tongue back into the airway. If they open their mouth, the open mouth position further facilitates the jaw and tongue to fall back into the airway, accentuating the snoring, and the tongue may become larger over time. Everything we do to improve the cross-sectional diameter of the nasal airway will reduce the forces that produce vibration and snoring and allow the patient to sleep with a closed mouth position. If we've made that ideal and the patient still has some snoring issues, the addition of an oral appliance to pull the oversized tongue forward will further reduce the snoring complaint.